Welcome everyone. This video presentation covers the management of symptoms post-vaccination as outlined in the PAC vaccine job aid. So where in the job aid should you turn to manage a client who presents with symptoms following vaccination? The contents page shows that symptoms post-vaccination can be found on page 20 of the job aid. This page provides guidance on how to manage clients that return to a health facility with symptoms. It does not include the immediate reactions that present in the first 15 to 30 minutes during the observation period post-vaccination. A separate training presentation exists for this. So let's turn to page 20 and take a closer look. Here is page 20. We'll need to zoom in to have a better look at the content. You will see at the top of the page that there is a note which confirms that no routine follow-up visit is required after vaccination, and that this page is specifically designed for the management of clients who actively seek care. It also reminds you to report any adverse events as an adverse event following immunization, or AFI for short, and shows you that you can find further guidance on this on page 23 of the job aid. Next is a red box that describes signs and symptoms that require urgent attention and referral. These signs and symptoms represent serious side effects or conditions, and although these may be very rare, it's important to check that your client does not have any of these before moving on. If the client does not need urgent attention, you can proceed with the algorithm below, which starts by asking if the client has fatigue, muscle aches, a mild headache, feels feverish, or has chills. If the client replies yes, you will follow the left-hand side of the algorithm. It starts with a prompt to check the client's temperature. If it's less than 38 degrees, we'll continue down the far left-hand side of the algorithm, which indicates that it's most likely that these symptoms are due to vaccine reactogenicity or part of an immune response. We'll explain this more in detail in a moment. The guide then directs you to manage this in the following ways. Reassure the client that he or she is experiencing a common immune response. Give paracetamol to take as needed. And advise to return if the symptoms get worse, the fever lasts more than 2 days since vaccination, or if headache, muscle aches, or fatigue last more than a week since vaccination. Going down the other pathway, if you found that the client's temperature was 38 degrees or more, you would want to know how many days since the vaccine. If it was 2 days or less, you would want to check for other COVID symptoms, like difficulty breathing, a new cough, a sore throat, or a change in taste or smell. If no COVID symptoms, then it's likely that it's still vaccine reactogenicity. Note there's a prompt to cool the client with a very high fever. More detail on this is given in the footnote if we zoom out. Footnote 1 explains how to cool them down. At this point, I'd like to remind you not to forget to report adverse events by completing and emailing the AFI forms or using the MedSafety app. Before we continue with the other possible pathways, let's take a brief look at what reactogenicity is. To understand this, let's start at the beginning. What happens when you get infected with the coronavirus? Your body has an immune system, or an army, whose job it is to fight infections. When you breathe in coronavirus, your immune system fights it and tries to kill it. Often, the immune system kills the coronavirus, but sometimes it overwhelms the immune system, making you sick. How does the vaccine work? In simplified terms, the vaccine introduces inactive pieces of the coronavirus into the body so that your immune system learns how to recognize the virus. Remember, the vaccine cannot give you coronavirus disease. This process trains your immune system to recognize coronavirus effectively, so when and if you do catch COVID, your immune system recognizes it quickly and prevents it from making you severely ill. So, as the immune system responds and builds its army in someone who has recently had a vaccine, they can get some of these common symptoms which we call side effects. a sore arm at the injection site, muscle aches, fatigue or tiredness, a headache, fever or chills, or nausea. Reactogenicity describes the short-term reaction of the immune system to vaccines. These side effects can start as soon as 6 hours after vaccination and usually last 1 to 2 days. Let's go back to the algorithm and follow the last pathway on the left-hand side of the page. If you find that a client has a temperature of 38 degrees or more and was vaccinated more than 2 days ago, then it's possible that he or she may have COVID and a COVID test is indicated. It would be necessary to advise the client to isolate while you're awaiting the result. Reassure this client that the vaccine does not affect the PCR or antigen test reliability, and explain it's possible, though less likely, to get COVID after being vaccinated. This is known as a breakthrough infection. Explain that the risk of severe COVID is extremely low. It may be that the client was infected just before being vaccinated or before the immune system had had time to build up protection. The subsequent management of this patient will depend on the test results. If COVID positive, further management can be found in the PAC COVID guidance. If COVID negative, then further assessment of symptoms could be done using the PAC adult clinical tool. Returning to the top to the presenting symptoms, if the client does not have fatigue, muscle aches, a mild headache, fever or chills, we would follow the pathway to the right, first double checking that the client has no other symptoms that may indicate a breakthrough infection. If no COVID-specific symptoms, you would move on to manage according to the presenting symptom. If the client has a local reaction, meaning redness, pain or swelling at the injection site, reassure that these reactions usually resolve within 3 days, and advise him or her to apply ice packs or a cold cloth to the area for symptomatic relief. It outlines when you would need to discuss or refer the client, if pain is severe, if blisters, if enlarging redness of 5 centimeters or more, or if an abscess, as indicated by a red swelling with a fluctuant center, is developing. If not a local skin reaction, but rather a client presents with new joint pain in the shoulder of the vaccine arm, then it's necessary to discuss or refer the client to exclude a shoulder injury related to a vaccine administration. If any other symptoms, further assessment can be done using the PAC adult clinical tool. Again, a last reminder to report adverse events by completing and emailing the AV forms or using the Med Safety app. This brings us to the end of this session on the management of symptoms post-vaccination. We continue to extend our sincere thanks for playing your important role in the rollout and serving the people of the Western Cape.